In studio, we've got Dr. Mercy Korir, who is a health journalist and a medical doctor as well. Mercy, thank you so much for joining us. There's quite a lot that is going on right now around the country, but I guess a hospital without doctors makes the situation even more dire. The demands for the doctors, can they be met 50-50 in between, or do they all have to be met with this collective bargaining agreement?
I think what should happen is that the government and the doctors should sit and discuss and come to an agreement, because I don't think the doctors will refuse to consider anything that the government offers, or the government will not give the doctor something reasonable. So the stalemate that we are facing, or we are seeing now, is that the doctors are holding on to the CBA, which is a document that was discussed for about 18 months before its signing in June of 2013, and it has been a document in discussion for the last 3 years between the doctors and the government. So they feel that the government had been dilly-dallying and not wanting to implement the CBA, because they had been shifting them from one government office to the other, from the SRC to the Ministry of Health to the county government. So the doctors have stuck and held the national government now to implement this CBA, because it's the national government which signed. Now, on the other hand, the government is insisting that, well, this document was signed on the 27th of June 2013, and the representative of the government who signed was the then PS for the Ministry of Public Health and Sanitation. And at that time, the national government is saying they had already merged the two ministries from the Ministry of Health, Ministry of Medical Services and Ministry of Public Health and Sanitation to be the Ministry of Health, which is what we currently have. And they had already gazetted a new permanent secretary who should, principal secretary who should have then signed. So the national government is saying they do not recognize that there is a document called a CBA. So the government wants the doctors to go back to work with the offer that they had offered, given them at the beginning of the strike, and then they can rediscuss the CBA. But now that's where the stalemate is. But let's remember that this CBA does not only offer a salary increment to the doctors. We have a serious component of training. And if we have seen, the president and the government has been going around launching medical equipment through the managed equipment services, but we don't have the skilled personnel or the skilled medical personnel to run this, some of this equipment. So in the CBA, there is a training component where the national government, which according to the Constitution is tasked with training, so that they can have at least 400 residency positions to train doctors in some of these specialized services, so that they go back bonded to offer services.
All right, so do you think that it was selfish of the government to meet the conditions of the nurses and not the doctors as per? Because what we saw was the nurses going on strike first, and then the doctors as well. Then the demands of the nurses met and the doctors' demands not met. Is this selfish on the government side?
The nurses' demands were different from the doctors' demands. And from looking at the analysis, the nurses' demands were not as complex as what the doctors are demanding. The nurses wanted a recognition agreement and a set way to discuss their collective bargaining agreement, which they did not have. So the government, this was just paperwork that the government that was easy for the government to yield into and give. And now, on top of that, they gave the nurses what they call the nursing allowance, which was ranging between 15 to 20,000 on the different, depending on which the different job cadres. So for the nurses, I feel that for the government, it was an easier strike to sort out. But now on this other side, the doctors have stuck to their guns and they have stuck to the CBA, which they say the government had already signed, so they should honor it.
All right, so some of the doctors have called for the withdrawal of the KDF medics from some of these hospitals where we're actually seeing some of them practicing. But Mark, I would like to hear from you as well, from where you're at. Are the private practitioners, if any, are there saying that, you know, they're also not going to go to work whatsoever? Or is it just for every Thursday that they're not going to work? Is it just only for Thursdays, or it's for the rest of the time that the public doctors are going to be on strike?
Joy Doreen, I'd like to point out that the shortage of doctors has made it such that doctors who work in the public sector also tend to go back and work in private medical centers. So what happens is that if there's a shortage of doctors all around, it means that if doctors in public institutions decide to down their tools and they also do it in the other side, it means that the pinch will get more painful for the wananchi who will be seeking medical services. So it just cuts across. So when they start striking every Thursday in private clinics or private health facilities, then the pinch of the strike will be more severe than if they decide to stick to the public health centers alone.
All right, so you say you are awaiting an address by the KMPDU officials, but are they actually giving you a sense of any headway from where you're at right now, from your observations and maybe from your one-on-one conversations with some of them?
When it comes to discussing the CBA, if the government side decides to yield, then there might be a headway today. But on the other hand, there's this other complication about the court, where they're supposed to go for sentencing in court tomorrow. That complicates issues here. Yeah. And as I earlier mentioned, when it goes back to the first days they were striking, they complained about a hidden government hand in interfering with their right to strike. And it remains to be seen today if they will reach an agreement, what will the courts do tomorrow? So there is that hidden element of the involvement of government, whether it has a hidden hand in the courts of law or not. So that's the complication that might arise today.
All right. Well, thank you so much, Mark. Dr. Mercy, as we come to a close, what is the best that the doctors can offer to the government right now? Or what is it that the government can offer to the doctors right now that can probably get the doctors back to work?
Okay. That's quite a tricky question to ask me, because because I know what the doctors have stood, and their resolve is quite tight. If they are not getting what is in the CBA, they're not going to work. I remember the doctors' resolve from their planning and whatnot before going on strike. The doctors are willing to go for a minimum of 6 months on strike, minimum of 6 months, because they are comparing it with the longest strike, doctor strike we know from the Israelis. So the doctors are willing to go all the way until they get what is in the CBA. So now the onus is on the government, because I know there's the discussions of the budget that are coming up, which will be earlier than in the previous years. So it's for the government to go back and see if they can cater for what the doctors are demanding.
All right, so we've seen some medical doctors who have been spoken to saying that they're human beings first before they're doctors. And so we're looking at a situation in our hospitals where people are likely to die. Some have already died, actually, just because medical doctors are on strike. So I understand that, you know, the fact that you're a human being before a doctor comes first, but then again, how much more can you wait as more people die at the expense of meeting your demands in a collective bargaining agreement?
I think there's a thin line between being human and being a doctor. Because as a human being, any human being has their basic needs from the Maslow's hierarchy of needs. Everyone has their basic needs. The same basic needs you have are the same ones that the doctor has. So if they're not able to meet this, and they cannot go any extra mile to be able to meet them, remember that as a doctor, let's say an intern, can go for up to 72 hours on call, not doing anything else. Whereas anyone else would probably go for 8 hours in a day. They have time to do anything else. So for the doctors, it's really a catch-22 situation. But now, in the current strike, and I think this is one of the things that people don't quite understand, or the Hippocratic Oath. The Hippocratic Oath will apply when I have come in contact with a patient or with a sick. That's when it applies. But before you, let's say now, you don't have any medical needs, the Hippocratic Oath does not apply. So I'm just myself and your joy. So, but at that time, when now I have seen a patient and I'm attending to them, then the Hippocratic Oath comes in. So when the doctors are out of work, not working, the Hippocratic Oath does not apply to them. And that's, I think, where we have missed the point. But if I go to a hospital now and a sick patient comes to me, I have obliged to offer services.
Right.
So, but before they get there, it's the government and the relatives and the friends who are responsible for that person.
For the patient.
And as,
All right.
as of now, the government is responsible to offer us the highest quality of healthcare. So as long as the doctors are out there, then the owners and the responsibility is on the government to actually take care of our health.
All right, great. Well, thank you so much. I see we do appreciate the time taken to elaborate some of these issues. Medical doctor Mercy Korir and also a health journalist here at KTN News. Thank you so much.